Hey there guys and girls, and welcome back to another video from Tinfoil Hat Advised. Today is a really quick video. I have done a screen grab on yesterday's UK governmental briefing. If I can get my words out, it's very early in the morning, sorry. And they said some crazy stuff. They publicly have admitted to falsifying the COVID-19 deaths. Now, depending on which way you want to look at this, they have potentially massively undervalued the death rate, but it looks more likely that they are massively overvaluing the death rate from COVID-19. So the reason I say it's more likely they are overvaluing it is because there is more benefit to them in overvaluing it and then pulling it down later than there is in them undervaluing it and then having to potentially admit later that there was more deaths. They are including figures from what they said, basically from anyone that a doctor thinks may have died from COVID-19, possibly, without testing. They're also they're also involving patients because they died and the figures were lower last year. Now, they're saying that that figure is potentially between 5,000 and 6,000 people a week being added to the figures just because they died during COVID-19 and last year the death rate was lower. That doesn't mean they died from COVID-19. You have to test them. You can't put facts and figures out there. I mean, I saw one comment on this saying, that's like saying someone died from a gunshot wound when they didn't get shot. I mean, it's just ridiculous. You can't put these kind of falsified facts and figures out there. It makes us no better than China. The video I'm about to post up after this one that I'm in the process of editing right now is about how China falsified their figures early stages. And I've already done a video on how there's just some stuff not right about this, that governments appear to be taking advantage almost of these facts and figures and of the pandemic and extending it to their own will by using falsified figures to keep their population in fear and in lockdown. There's something just not right. Now, you could argue with me on this if you want to, and that's fine. But the clip you're about to see, it doesn't make sense. Why they're putting these figures out right now in the way they're putting them out and the way that they're using the statistics, it's just not right.
Patrick, I'll let you address that one.
Well, as I said before, I think it's very important to have the hospital death rate and the total death rate. It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference.
The ONS data, of course, tells us not only the people who are diagnosed as having COVID on the death certificate, with a diagnosis, some of which is on a basis of tests, some on the basis of the fact the doctor thought it was likely but not definite. But it also gives an indication of what's called excess mortality, the difference between the normal death rate, sadly, at this time of year, and what we've got at the moment. And that's been changing over time. And there are some additional deaths on top of the ones that you would expect for this time of year. So in the last week for which we have data from ONS, 3,475 people were diagnosed as having COVID, some of them from in-hospital, some of them from out of hospital. But the excess mortality was, over, in terms of the period as a whole for that week, was, depending whether you compare it to the week before or at the same week last year, somewhere between 5,000 and 6,000 people. Now there's a gap between those.
So I hope you see after those clips just how ridiculous these falsified facts and figures are and how bad they are. I mean, yeah, potentially they could be undervaluing because they're not testing. But the more likely option is they are massively overvaluing and over-exaggerating and overinflating how bad this pandemic is to keep people in a state of fear, to keep people locked in, to keep people acting the way they want them to. I mean, let's be honest here. At the minute, the government say people do. That's the general way this is operating. And yeah, there's people that are breaking that by going to parks in the UK and in other countries. And in some countries, we're seeing riots. But the large-scale population of the world right now is doing exactly what they're told by their government. Why would a government want to relinquish that earlier than they have to? They have complete control right now. It's what a government craves and begs for. This is the closest Western society has come to a Chinese style of rule in generations. We are doing everything we're told, and it appears that they are falsifying facts and figures to keep us that way. And that's scary, and it's dangerous. And more questions need to be asked about why testing is taking so long in this country when other countries are just miles and miles ahead of the UK, of America, and of a lot of other countries that are clearly choosing to not test. So, yeah, there's a lot of questions that have come out of this, and they've publicly admitted to falsifying figures, and no one's really questioned it, and that worries me. I hope you guys have enjoyed this video. Please like, share, and subscribe. The biggest bit of this is you liking and sharing the videos, because then the channel grows and more people can get involved. Please comment on below whether you think I'm right, wrong. Share whether you think I'm right or wrong. Start debate. Let's get talking about this, and let's just get some more questions asked about everything that's going on in the world right now.